Clinicians here and across the country had expressed concern about a possible post-holiday COVID spike, with some people traveling, gathering, and celebrating. Dr. Michelle Bache, Vice President of Medical Affairs at Elkhart General Hospital, is here today to talk to us about what we've seen and where we stand today. Dr. Bache, what can you tell us?
Hi, Heidi. Thanks for having me. I have great news to share today. Obviously, the situation in our county has improved significantly since the dark days of November, when we were really dealing with a significant COVID surge. The hospital has really benefited from that. We've seen a significant decrease in the number of COVID patients that we have in the hospital. Our census today of COVID patients is down 60% from where we were in the middle of November. Our deaths are going down. And this is really great for the community as a whole, not just the hospital. This has allowed us to really ramp back up our surgical services. We're able to provide additional healthcare services to the population besides just COVID. So it's been really great.
Why haven't we seen the surge? We still have COVID patients, but again, that surge didn't come after the holidays.
Right. So, I think that the community really took the message that we were trying to deliver to heart and really listened to what we said. And thankfully, they were limiting gatherings. I know, personally, people were not traveling, were not getting together with big groups like they maybe historically had. And, mask usage has really gone up. I noticed just anecdotally walking through my community that, many, many more people are wearing masks, and the masks are working. So
what message do you have, Dr. Bache, for members of our community?
Really just a huge, huge thank you. Thanks for all your efforts. I know what we've been asking for is really difficult. It's really hard. Life is hard right now. And, nobody wants any more than me than to, get through this and get back to life as normal. But, everybody just hanging in there, wearing their masks, limiting their travel, limiting their gatherings. You have made the difference for us. You have done this. And I can't thank you enough.
Because we haven't seen a surge and we have started vaccinating certain groups in our community, are we completely out of the woods?
Well, unfortunately, we're not out of the woods yet. COVID-19 is going to be with us, I think, for the foreseeable future. COVID-19 is, has the ability to really spike out of control very rapidly. And I think that's what we're seeing in other parts of the country. And frankly, that's where we were back in November. So once you have a local infection that really takes off, it spreads very rapidly, and it becomes very, very difficult to rein that back in. It becomes difficult to contact trace. It becomes, really hard to interact at all. So if we can, stay at the level that we're at now, I think we can, and hopefully make further improvements. I think we can have maybe some sort of a normal life, but it's going to be a while yet before we're able to get rid of the masks and really have the life that we knew before.
So we still need to mask. We still need to social distance. What advice do you have for us moving forward in these weeks ahead?
Keep doing what you're doing. So we do not want to get back to where we were in November. We want to be able to have our kids in school. We want to be able to, have smaller gatherings and do these sorts of things safely. It's probably going to be, the end of the summer or, late into 2021 before we can really hope that our vaccination will, get to enough people that we can begin to relax a little bit.
Dr. Bache, thanks so much.
Thanks, Heidi. Have a great day.